All right. Because we're tight on time, I'd like to go ahead and begin right away. So, assuming that we are visible and everyone can hear us, thank you for joining us today for the second of 3 webinars in our Talking Telehealth series. This one is Telehealth Techniques, Quality Care Online. I'm Sean McMillan, Executive Director of First Step House and the 2020-2021 Chair of the University of Utah College of Social Work's Community Advisory Board. As returning guests might recall, the idea for these webinars originated in a board meeting in April, as my fellow board members and I shared about our experience of launching into telehealth to meet client needs during the COVID-19 crisis. We recognized in the space of a week, our organizations and many others moved from strictly in-person care to exclusively telehealth care, we had to adapt quickly. We had learned a lot, but had many, many questions. Board members, supported by the College of Social Work, Dean Martell Teasley, Professor Brad Lindahl, and others in the college began talking with community partners about lessons learned and long-term goals for telehealth therapy, including what is the best way possible, what is the best way to provide this care now and going forward. The result is this Talking Telehealth webinar series. We intend this series to be a conversation with community partners all around these issues. We do not presume to have a definitive answer to telehealth care, but we do hope to share our insights, inspire conversation, and explore what the future might hold. The more voices involved in the journey, the better. So thank you for joining us. Our moderator today is Misty McIntyre Goodsell, Director of Research and Development at Odyssey House. She will introduce you to our panelists and facilitate the online discussion. Misty.
Thank you, Sean. And welcome, everybody. I know more and more people are joining as we go, and we have 3 wonderful community partners with us today. We have Brian Thorne, Janelle Naima, and I'm hoping I got that right, Janelle? Yes, and Mariah Peterson. And we also have Flower, who is this lovely telehealth therapy dog who's also joining us today. So just so you know, I'm going to let everybody introduce themselves more fully, but just to kind of get going, there are 2 features. We have the chat feature. If you would like to share a story or a thought or a comment, please feel free to use that. We have that up and running. And we also have the Q&A feature, which if you want to submit questions for our panelists to respond to, we want to meet you where you're at and get you the information or share our experiences with you as fully as we can. So to kick that off, Brian, would you like to go first and maybe introduce yourself and share a little bit about some key takeaways or some things you've learned as you've transitioned to telehealth?
Sure. Well, I am a psychologist at Primary Children's, and I've been there for about 18 years. I'm also with the University of Utah Department of Pediatrics in the School of Medicine. And I'm at the Center for Safe and Healthy Families, where many of you may already know. I know some folks on the call are maybe participated in trauma-focused cognitive behavioral therapy training with me and my colleague Amy Oxman. We've been doing that around Utah for almost 10 years now, and have had a lot of therapists participate in those trainings. I've been really fortunate to be able to get to know a lot of folks, including Janelle, through this process, as she reminded me of, who's also one of the panelists, was one of our early participants. And so we focus on abuse and trauma at Safe and Healthy Families. I'm really honored and appreciate being asked to be on this panel, and have definitely spent a good deal of time thinking about this, but I certainly want to admit that I've been doing telehealth therapy for about 2 months now, probably about the same amount of time as all of the rest of you. So much of what I've been learning has been recently learned, and I'm pretty excited about the prospects of being able to use it especially to be able to access people who are off the Wasatch Front, families and kids who are in remote areas who may have a high-speed internet connection. There are definitely those limitations for those who have the option to be able to use a high-speed connection, then there are definitely some possibilities, but a lot of the folks we work with are low income and have challenges with having the right kind of technology. So we've observed a lot of those kinds of things, but I have been personally really impressed and amazed at how many of the kids that I've been working with and the families, even despite the challenging situations with getting adequate internet connection and having the technology available, have really taken to continuing therapy and or starting up therapeutic services in this kind of an environment, and that it has been really successful in many cases. I've had a few people who have not continued with therapy when I think they would have if they've been able to come in to meet face to face and for various reasons. And so I feel like there have been some losses related to that. And I work with a lot of really young children, and I found that it's not really as feasible to do just a one-on-one, face-to-face kind of interaction with a 5 or a 6-year-old on a video conference sort of connection as it is when I can meet with them, just the two of us in my office for a little while. But parents have been really on board with trying to facilitate that. And we've had definite successes with plenty of teens and preteens who are very much interested in being able to continue their therapy and totally comfortable with having, video chat kind of conversation. So very much encouraged with the possibilities for things moving forward and recognizing where some of the challenges are for us to be able to meet the needs of everybody through this medium. So happy to hear what other people have to say and happy to contribute to the discussion.
I was muted. Thank you, Brian. There was a lot of really great stuff in there that we'll definitely come back to. And I just want to say, if people are just joining us and you weren't here at the beginning, just make sure if you have questions or thoughts to share them in the chat or the Q&A. But we'll keep moving forward. And Janelle, I wonder would you like to go first and introduce yourself and share some of your thoughts too?
Yeah, so I'm Janelle Naima. I'm the administrative director for For Healing Center. And this is Flower. She's our facility dog. We found that, we have a lot of clients who have really enjoyed the transition. And they've even started coming more times a week because of it, which has been really interesting to see that they've needed that extra help. We've also had some of those technology issues where those clients who are in the low income their internet may not be as fast. So we've even had to do like the doxy call, but then also call on the phone so we could actually hear them. So being able to have that opportunity to, see them, but then call and work through those issues. Our teenagers have had some struggles with being able to be alone. So really making sure that we have that confidentiality conversation with them, with their parents multiple times. I have a teen that we talk a lot in her car just so she can have that quiet time so parents don't come and bother her. So she's doing the telehealth on her phone that way. So those kinds of things, we really try and work through those issues just to make sure that we do still have that HIPAA compliance and that confidentiality. So that's been kind of going on. A lot of our little kids, we've only been able to keep some of their interactions at the 30-minute session. And we've also had a lot that have kind of stopped coming to therapy where they want to wait and do that in person. Some of our autistic kids have had a hard time self-regulating and really engaging in this telehealth thing. So we've started moving more toward the video game telehealth, which has been really interesting. So we'll each pull up while we're in telehealth Minecraft and get on the same server and play at the same time. And so that's also been kind of fun. Whereas, we might have done that in the office where we would play it on our PlayStation or our Xbox, but it's been really cool to see that experience as well. It's also been a lot of fun to incorporate Flower. for those of you, when she first came on, yeah, she hears her name and she looks. She does the same thing when we're doing sessions with our clients. So she really enjoys that. And we'll, read books to her. We'll, paint with her. She's learned how to hold a paintbrush with her mouth. So she'll paint and the kids will give her the push command. And that's been really a lot of fun, while we also teach mindfulness with her and with their stuffed animals. And so really engaging that way has really kept a lot of the sameness that we did in the office on telehealth. And so it's created that normal session for them, even though it's in this kind of new environment, which has been really important.
Yeah. Awesome. Thank you very much. I mean, I'm writing down notes, if you guys don't know, about all the things I'm going to be training my supervisees on after this call too. So there's a lot of great examples in there. So thank you very much. Yeah. Mariah, we'll give you a chance to introduce yourself and share some of your thoughts. And
thank you. Hi, Misty, good to meet you. Dr. Thorne, good to meet you. Dr. Naima is my boss, everyone, so I know her and I know Flower very well. So it's good to see everyone today, and I'm really excited to be here. I'm Mariah Peterson. I am the clinical manager for Janelle at For Healing Center and Animals for Healing. And I am an LCSW. I received my degree from the University of Utah. And then right after I grew up here, and in 2006, I moved to Denver, Colorado, where I was for 15 years. I'm aging myself. And then recently, and I did women's behavioral health, focusing on eating disorders. So that's my passion. That's what I enjoy, a lot of trauma work. And then I moved back, to home, and Janelle, being wonderful, hired me on, and I've been loving every second of it. I've done telehealth prior to this, so this isn't new to me. And I love it. I think there's so many wonderful advantages to telehealth. And in regard to that, I tell my clients, think of what we can do versus what we can't do in this element, right? You get to wear your pajamas, you maybe get to be in bed, you get to have autonomy, you don't have to waste gas. And there's sometimes this nice barrier of comfort for folks that really struggle with disclosing things. There's a safeness and a softness of telehealth too. And that's what I really enjoy about it. And I enjoy my wonderful other boss, Janet Naima. She is an expert basically in EMDR, and she's a mentor of mine. And seeing somebody's house, seeing how they live, seeing my green wall is telling of how boring I am. But it's nice to see how sometimes people are in their real life and to give them that safety. And I'm a fan of it. In regard to that, I know we have follow-up questions, so that's how I'm going to speak to it about it right now until the questions are asked. But I absolutely think it is a wonderful platform, and there's always a way to navigate it. Are there some barriers? Absolutely. I think Janelle addressed those, and Dr. Thorne did as well. But barriers are just ways to make solutions. So yeah, so I'm excited to get to know everyone and talk about this because it is new. It's a new norm.
It sounds like you're a glass half full person.
In work life, yes, I'm a trained therapist. Yeah, right now I am. Yeah, but I like to be. I like to think that I can be. So, but there are barriers. It's tough. There's a lot of issues with it too. But for the most part, that's my job, is to help people navigate their experience with the new norm and with technology and what's going on. So it's been fun. Yeah. And I get to wear my pajamas. So who wins here? Yeah.
That's right. So many good ideas have already come up, but I wonder if to start with, maybe can we talk a little bit about the differences in providing services maybe to groups versus individuals in this format, and what your experiences have been, or if there are unique challenges when you compare them.
If you guys don't mind, I can speak to that. And the only reason why is because I'm actively running a DBT group. As Janelle knows, I was pretty anxious about it. I wasn't anxious about the individual aspect, the one-on-one, but navigating a DBT group, if you know the population, it can be difficult. I feel like I'm wrangling people more than I'm teaching a skill at sometimes. And, in our clinic, we have this beautiful group room, and it's so lovely to have that connection. And I was really worried. And I spoke to Janelle about it. I was anxious about it. You know, my half glass full was not half full at all, Misty. So there you go. And so she's challenged me. She always does. You're going to do this and you're going to be okay. And guess what? I was okay. Was there technical difficulties? Yes. But it's that fear of, I think, for me as a clinician, of the technology. And then I taught myself how to do it, and it's not that bad. And we normalized it. And our first DBT session was using Wise Mind about technology, right? About this new norm, because we're a tight niche group and calls drop off, right? And I don't have time to call IT to be like, help, when I'm running a group, when somebody's dysregulated. So we talked about norms. We made new group norms. We laughed about it. We talked about, you know, the positives about it. So it is a little bit of a different dynamic, but once I practice it, I think with anything and learning how Zoom and Doxy and the platforms work, then for me and the clients, it was kind of empowering. It's like, wow, well, I can Zoom in one day if I didn't want to drive to clinic during group, if I was having a bad day and I'm socially anxious and I couldn't go to group, but I can Zoom in. So that's what we're looking forward to, is moving forward with the options of this. And it's empowering, but it does work, but it's hard. I'm interrupting a lot more than I normally do. I'm muting people sometimes. They're muting themselves and talking like we sometimes do. But for the most part, it's the dialogue and the interaction with everybody, and just radically accepting that this is kind of how it's going to be from now on. And it's kind of cool that we can do this, that we have this power. Had we not had this technology a while ago, you know, amid Corona, what would we have done? So this is a wonderful thing. Yeah. But I will say sometimes it's hard. Yeah. The losing connection stuff is the hardest. The technology part's the hardest. The other stuff, not that bad. And really, it's not that bad. It's always fixable. So in my experience, it's been pretty good. It's just that initial learning the platforms.
Brian or Janelle, do either of you have any other thoughts or experiences about groups versus individuals?
I can jump in for a minute. You know, I mostly to say I'm not involved in doing any groups right now, but working with families and parent-child dyads presents the group sort of situation that is certainly has its own challenges compared to speaking with someone one-on-one, you know, and face-to-face. And certainly, I mean, one of the biggest things that I feel like I've learned, and it's one of those lessons that I keep, you know, relearning throughout my life, and I always wish I could, you know, fully learn it, but it's about being patient and hanging in there and rolling with those connection difficulties when the audio cuts out, or usually the audio goes fine, the video can cut out. And, you know, I had a session this morning with a mom and a 7-year-old girl, and I could only hear about probably 60% of what was said, but they were fully engaged and really very much on board with having a therapy session, and really engaged in continuing to work on things at home and making big changes and involved moving to a shelter. This is all during the pandemic crisis, losing a job, moving to a domestic violence shelter, finding an apartment, you know, and moving out, and all the while maintaining regular therapy appointments. And I think really still benefiting from the process, even though there's a lot that I can't see and that we haven't necessarily been able to do, there's still engagement and personal connection there that has been really valuable. But it's been hard to weigh the you know, to have the same level of interaction with each person when there's a group involved on, you know, in each session. And I can't see what's happening, you know, offline or outside of my window. But those things haven't been obstacles that have prevented us from making therapeutic progress. So that's been enormously encouraging, and, you know, helps me feel really upbeat about the potential for us to continue to use this kind of telehealth process in really positive ways, when I hope we'll able to go back to face-to-face, even though this may be a new normal forever as far as an available medium for us to use. I certainly think that there are some cases, and we can talk about some of the challenges here in a little bit later, perhaps. But some of those cases where I feel like we haven't been able to quite get there because of the distance and the wires between us.
We did have a question come through that said does anyone have any experience with doing traditional therapy with children, and how to address the parent being present or not? What has worked for you? And it's in the chat if you guys want to read it, but I think it kind of relates to what you were talking about, Brian.
Well, I'm not, I'll try to be quick about this, but I'm not quite sure what the questioner is thinking in terms of traditional therapy with children, because I'm not a play therapist, so I'm not doing that kind of therapy necessarily with children, and that probably has some challenges that I haven't even thought of. But certainly I'm working with a lot of children and involving their parents, and I feel like one of the earliest lessons learned that was really helpful was to have a conversation right at the beginning of who's present, who's in the room, are you in a place where you can speak openly and freely, and making sure the parent is there and present, even actually, and I feel better with most adolescents if I know that because of the potential for a crisis situation to come up, to have a plan set up with the parent being at least available and having a phone number that I have placed, say, right in my schedule, that's right in front of my screen. If the emergency or crisis situation is kind of emerges, then or I have a team who signs off automatically or on their own without me being able to control that, and I'm worried about their safety, then we've got a backup plan for me to reach out immediately to their parent. And I think when it comes to working with the littler kids, I had, again, in that family I was mentioning from this morning, that was part of the challenges, that I really did want to have just a one-on-one conversation with this 7-year-old girl about her feelings and how things have been going for her, how she's been feeling about all the changes that have been happening with her family. And we weren't really able to establish that. I think it was a positive interaction and a good session in many ways, but I was really glad for taking the time to sort of check out what sort of privacy did she have, and was I able to talk with her freely, and was she able to respond without wondering what her sister was going to think and what her mother might say. Mom had a tendency to jump in and kind of speak for her. So some challenges with managing that, but I have also found that when you have that conversation up front and try to set it up with, I hesitate to use the phrase ground rules, but establishing those expectations and what do we, expect, or how do we want the setting to be how will it be most therapeutic, and being really upfront and explicit, about those things, and talking pretty directly with the parent about, this is what I think would be most helpful. Can we arrange that? But being available to assist. I think that most parents have been very willing to do it. And I think we've even managed to be able to do some parent-child interaction therapy that has involved, in some cases, just a cell phone maybe placed on a stand and leaned against a book, and parent wearing the earpiece a few feet away. And there's a lot that I can't see during that time, and that is a bit of a challenge, but everybody's been patient and willing to, work with trying to set things up in a way that is still helpful and allows us to achieve our goals. So I think thinking through those things and learning from your first few experiences, and then being proactive and getting things organized and planned up front, and having that conversation at the beginning of each session has been really helpful.
Thank you, Brian. I want to say we've had a couple of questions just about age groups and working with different age groups. In particular, it looks like a lot of people saying, like, how young of a child is actually able to do this kind of intervention or interaction with telehealth. And you can probably see the questions in the chat. And I don't know if Janelle and Mariah, I know Janelle at the beginning even talked about how to be adaptive even to different learning abilities, or just, with the autism and pieces like that too. If you guys have any thoughts about or experiences about how those are different depending on age group and the technologies. I see lots of head nodding, so someone's putting their thoughts together. I can feel it.
I'm going to let Janelle take that one because she works with kids and is very savvy. So Dr. Neimer, you get to do that one. I work with adults. So I can talk from that perspective, but the kiddo one and the learning is probably pretty important in regard to the question. I'm putting you on the spot, boss.
Well, and I think it has a lot to do with our office as a whole. And it really is breaking it down with the littler kids. That has been broken down into even shorter sessions, like I spoke to in the beginning. And so we'll see the kids for when they're 5 or 6 is probably as little as we've gone at this point for 30 minutes. But sometimes we'll spend the other 30 with their parents, kind of like what Brian was just speaking to, where we talk to the parents, we set up those ground rules, we put the parenting in place of, okay, what's happened this week? What kind of schooling have you done this week? What kind of entertainment have you done this week? You know, what have you needed to do with your job? How have you done daycare? How have you done, what's happened that we can help you with? How have we helped you regulate? How have we helped you prepare and handle your 5-year-old falling apart? Because they understand that you're falling apart. And so it's really being able to separate that and help them manage. But that's where, like when we work with the 5-year-olds, we're also working with their parents. And so we'll work that whole age range all the way up to the adults. We'll also work with the learning disabilities and the autism spectrum and that whole age group or that whole, I guess, mental health issues, where we're really helping the whole family in this situation, because we are bringing in their siblings. We are bringing in everybody to help cope with this new normal.
I can share a few things specific to doing trauma-focused cognitive behavioral therapy with different age groups. One of the things that we've found at Safe and Healthy Families, and I've learned a lot from my colleagues and the other therapists in our clinic about these kinds of things, and some of them I've learned about and haven't had a chance to use yet. But for kids, for example, in the elementary school age range around 6 to 10 or 11 or 12 or so, in doing a lot of different kinds of therapy with kids, but especially it's true with trauma-focused CBT, that using books to help them think about and maybe give voice to their own feelings or to share and teach different concepts is such a good fit for kids in that age range. And so we had discussions early on about, what do we take home and how do we have with us? Can we hold them up in front of the camera and still read them and talk about them? Well, happy to find that almost everything that we use has been found somewhere online, already read aloud, and with the pictures showing right there, in many cases on YouTube. And so once you figure out the technology and how you can share the audio, then it becomes something that's equally available almost to what we can do face to face. And bring up the book, we can both hear it, they can see the pictures very well, and then we can have essentially the same kind of conversation about it. So that was really satisfying to find that we weren't going to have that kind of big deficit or some way to have to make up for it or feel like it was just inadequate. That's really been positive. It's also been possible to use like PowerPoint and develop like a little interactive game and do some screen sharing that can help to, that can involve questions, or even so you can set it up something like a little bit of a game show that can be done in a way that can turn an interaction about getting to know each other and developing comfort with a new client to help that make that be a little bit more interactive and more fun. And we've also found we had some concerns about doing trauma narratives. And one of the things that I think is really quite important about doing trauma work is that they're able to do their writing in their narrative and their processing of it with their therapist, and then leave it at the therapist's office and not take it home with them and not be working on it at home. And so, one of the obvious options is to have their child, once they're ready to be able to tell their full story and talk about those details, to tell you, and then you can type it and while you're sharing your screen, and that works very well. But it's also really important that kids be able to do that in the way they want, and that they're able to you know, do things like add pictures and or have other ways of expressing themselves other than just telling the words. And we found some creative ways of doing that too. You can actually share cursor and keyboard control with Zoom, certainly, and I think with other formats as well. And so they can type it themselves. They can draw pictures on it, and then you can save it and put it on and save it on your secure server in your office, and they still aren't keeping it with them at home. And you can have the same sort of benefit of them keeping it contained to their therapy experience, but not having it there and accessible potentially to a sibling or some other person who, or for that matter, just have them feel like it's the burden that is sitting right there on their desk waiting for them, or being drawn to spend more time working on that story without having the support and the benefit of the therapist. So it's great that the technology is allowed for some of those same kinds of things, and it took us a little while to learn that stuff.
I have to say, Brian's a little bit psychic because he's always preemptively knowing what the questions are that are coming from the participants. So good job, Brian.
One thing,
I love it.
One thing I'd like to speak to the trauma narrative is we have Surface Pros, and one of the things that they have is a drawing app that we can share. And so while they do their trauma narrative or a lot of other interventions, they can also draw it and then leave it with the therapist. And so that's something that's really cool as well. So if you have a tablet or an iPad that you're using as part of your Zoom or Doxy or whatever that you can share that way, that's another cool way to do trauma narratives.
So I will ask, because one of the questions that came through was from a participant named Raquel. She says that she works for a nonprofit with very low income clients. They do counseling free of charge. And so what kinds of free technologies are safe to use, or have you come across or heard about even in other conversations that might be available to folks who don't have an iPad or don't have great, internet reception? Like, what kinds of suggestions do you have for those folks providing service?
Free technologies for what specifically?
It just says free technologies that are safe to use. So I'm assuming, and if Raquel wants to make a note, but probably in providing therapeutic service or even in doing any type of therapy service. So what kinds of, do you know of any, because you've had a couple, YouTube is a great one, free, almost everyone can access, right? The one you were just speaking about, I think we're all familiar with. Zoom is free for the participant if they have the technology that can download it, right? But Raquel says in providing therapy. So what kinds of thoughts or feedback would you have about that?
So Doxy is also free.
Okay.
We send a link and they can use it on their phone. They can use it on the internet. It's HIPAA compliant. Zoom is the other one.
It certainly makes sense to use the password option and be mindful of technology in that way. I didn't know about Doxy. I'm gonna have to look into that. So that's good to learn about. All of the things that I talked about were actually free. I mean, if you have, even with Microsoft Word, if you have it on your system that you as the therapist are using, then when you share the screen with the client, then and if you give them cursor and or keyboard control, then they can, they don't need to have those programs. They don't need to have anything other than the internet connection to be able to do that stuff. So it really, in many ways, does replicate what we can do, in our offices. They do need to have, at least, I would say, and it's certainly not ideal, a smartphone that has, internet access. And that definitely does leave some people out, because I'm not sure that there's a public setting, at least not that I'm aware of, where somebody can go and have internet access and have a computer to use and also have the appropriate privacy for a therapy session. Maybe that's something that could be, available and made available publicly in some way if we were, still in this kind of a situation long into the future, That's part of what I've been really encouraged about, is that if you have a smartphone, and almost all parents, even in low-income families, it seems like do these days, then there is some ability to be able to do, reasonable face-to-face therapy, video conferenced. And all of these options that we're talking about so far are freely accessible.
And it sounds like James in the chat is saying there are places in the Valley that do have free internet that people could drive to and access the internet, if nothing else, although that does
from their car, perhaps.
Yeah.
That's a great idea. That's a really good idea.
The parks are doing it now. I was walking through Liberty Park, and they have it. So no, it might not be, ideal, but they could go on a picnic and, get out of the house at the end of the day. So there are those resources. And I think, Brian, you're right, as this continues, the resources and the technology is gonna become available, right? Because none of us were trained on how to do pandemic therapy. I didn't take that class. So we're all learning it together, So yeah, and all these ideas are creative. There really are. There's always ways to do things, to get support, to get connection for resiliency. Yeah.
Well, and keep in mind with like Medicare and Medicaid, they've released the guidelines for HIPAA compliance right now. So Skype, FaceTime, you can use these things, just the phone. For now, during this pandemic, everything is okay to use. So whatever your client can have access to right now where those guidelines are loosened, it's okay to contact your client. It's okay to use whatever you have to do the therapy session.
And I think we always educate our clients on the limitations of those things.
Absolutely.
So they know that we have had those restrictions loosened a bit so that we're more concerned with us doing the work than it being done as perfectly as possible. I mean, we're doing the best we can. They want us to do the best we can is the message we're getting, right?
If you have Google accounts, like Google business accounts, Google Meetup, I think has changed. So you don't all have to have Google. So you can invite clients to Google Meetup now. I think it used to be just Google to Google accounts, but that's now open to everybody. So that's another one that I think you can use, and you sign the BAA if you have Google Business. So that's HIPAA compliant.
So I do want to say this too, because I know in the next webinar, I believe we're having next week, they're going to go a lot deeper into technology. So I'm going to encourage everyone watching to come back next week, because these are great questions and probably the group next week will be able to build off of them. But I do want to change gear just a little bit to a clinical track, because we do have another really important question, because we talk a lot about crisis counseling, something when we do in our office, we know how to control that environment. But we even had an anonymous attendee ask about how are we able to gauge from a telehealth view that a client may be unsafe? For example, maybe there's a DV victim that we're talking to. How do we talk comfortably? You gave the example about the car, like she goes to her car. Like, how do we gauge that as clinicians on the safety of the person that we're providing service with in this format? What's working, or what have you done in your practice?
I could tell you about one specific experience, and I've already mentioned this family where there's an active domestic violence situation that came up in the midst of our doing telehealth therapy. And the way it happened, I wanted to say there are challenges related to this for sure. I think especially given the risks associated with, for example, a suicidal teen who is not interested in participating in therapy, then it's, I think, in some ways easier for them to dig their heels in and potentially hide things. But for anyone who is, willingly and in good faith attempting to participate in a healing process, then there are lots of things that might be done to help. And we've talked about some of the setting the ground rules and establishing that sense of safety. This one family that I'll just say a little bit more about, I could tell that emotionally things were not as I expected with mom and child who were having an interaction, and I was talking them through. And what I didn't know is that the mom's partner, who had been recently violent and was escalating, was also in the room. and was off screen. And so what I did though, and it ended up being a helpful thing, was simply to send a call after the session with a separate phone call to the mother's phone number, and left a voicemail message saying that I would really like to check in with her and just to have a quick conversation. And at the time, I was thinking I wanted to have that conversation without my client present, who was her 7-year-old child. And what I got though was her really thanking me for reaching out and giving her an opportunity to go to her car, as already has been, mentioned here, which was the only place she felt like she could talk openly and honestly with me. But I don't think that would have happened had I not still been trying to, pay attention to the same cues that give me a sense of whether things are not going well emotionally. And it was, just as the person in the question had mentioned, it was a good effort on both mom and child's part to put on a mask as if everything was great and they were participating in this thing, but it didn't feel right. And I was really pleased to be able to feel like I could sense that in a similar way as I could if they were meeting with me face to face. And it just took a one-on-one reaching out to her over a medium that I thought with just a telephone call she might be able to do in private. And it was very helpful to have the phone call in the car.
At our clinic, we've set up a pretty extensive protocol for safety, because it is a different dynamic, right? We don't have them in our office, but it is per report. It is, what are you experiencing? If the client is endorsing this, then luckily we have the technology where we have teams where I could be on a session, somebody could endorse suicidality, or be in danger of something. I am my entire team, and somebody would be able to help, at least call 911, do a welfare check, call crisis mobile. So it's communication. I always have my phone. Our staff knows that me, Janelle, Janet, and Stacy, our other manager, we're always together to help folks be safe. Because at the end of the day, that's our job, is to help people be safe. So what can I do with you during this, session? You're not safe. I'm going to help you be safe. And it's actually pretty powerful, those types of communications and interactions. So the importance of communication and teamwork during telehealth is actually really important, because there's a lot of autonomy with it. However, we're dealing with folks that are struggling, and maybe they're struggling because of the pandemic. So it's having that support for clinicians and our staff, knowing that we're always here to help contact who we need to. And to know that they're not alone, and that our staff isn't alone. So if you are in a clinic, making a protocol of what you need to do when anybody is not safe or not feeling safe. So it's, writing new policies. It's, doing these types of things to figure out what's the best way. So with us, there's a lot of communication. And, at the end of the day, if somebody's not saying they're safe, I'm not going to bat an eye. I'm not going to try to convince them. I'm going to go make sure that police or someone goes to the house to check on them, because I don't have that. So again, thinking of what we do have. So,
and I know at our agency too, we've done a lot of chart updates with addresses and phone numbers and emergency contacts, right? And asking people, where are you, and or what's your address, just so in case we do have to send someone to check on them, we have that information. And I know that seems like a minor thing that we should always be doing, but some of our clients move quite frequently, and so it's always good to update that information too, and make sure that we, if the help is needed, that we know where we're sending help to as well. Brian.
It seems like a minor thing, but in just taking off from what you were just saying, Misty, having the phone numbers and things available has been available in a way that I can access it even if I don't have my secure connection open. So all of that stuff, if I'm in my office, resides on the electronic record system that is part of on the network for Primary Children's and Intermountain Healthcare, of course. But that takes a long time to establish that secure connection. It hasn't been 100% reliable. And sometimes you need to act more quickly. So thinking that through and having, like, in every single actual appointment box in my Outlook calendar now, I also have a phone number and an email address so that those things are accessible even if I'm not able to get onto the electronic record. That's been surprisingly important in terms of, in many ways, establishing a workflow for me for the day that helps me feel like I'm accomplishing the things that are important, and it's not leaving me completely wasted at the end of the day, feeling like I've been run through a ringer. It's been helped me to establish some norms that help to facilitate the process of making those connections so that they don't end up, adding extra stress and frustration, on the day. And of course, that can be a significant tool for helping to keep someone safe if they're in crisis.
Thank you. I'm curious now that, we're in the last quarter of the webinar, and I want to make sure if there are more questions that people are entering them, because we would love to take them. But as we look forward, right, as doing this clinical work and trying to do it in an excellent kind of helpful way, what groups do you think may be especially benefiting from this type of virtual experience, and why do you think that is, or what is your experience? What is the experience that's telling you why that is? Like, where do you see this going in that and in terms of that direction? And I'll leave you guys to jump in.
I think for me and the population that I work with, initially folks with social anxiety, and depression, actually, they were okay with this, right? Because this is their element. This is what I'm good at. I'm good at staying home. I'm good at isolating. And there was a part of me that I was like, well, this is great. And now there's a part of me that I'm like, well, now I got to get you out of your house a little bit too, right? There's got to be that challenge and acceptance. And so I had people thriving in this environment of finally, there's no pressure for me to do anything. I can just be here. Because sometimes even driving to clinic for folks is hard. It's challenging when you're really struggling. So that's what I've noticed in regard to my own personal clients and experience on that end. Also, populations, if I'm working with somebody that doesn't, a vulnerable population, somebody doesn't like to drive, people that are really busy. I have folks that will have, their therapy session during their lunch, and normally they wouldn't have been able to do that because they would have to carve out time to come, and now they just log on and we can do, some therapy. So I think that there's a lot of, those are the types of populations that I'm seeing it, people thrive in it. But then I also don't want it to be so normal that, social isolation and depression and therapy is okay to stay at home and never leave, right? So it's that balance that I'm finding right now. And folks that have a hard time maybe disclosing. I'm learning that I've had clients tell me, gosh, Mariah, sometimes it's easier for me to tell you things when you're not there. And then I have the opposite of, I need to be there. I need to see you guys. I need to see the staff. I need to see the dog. And I'm, so it's kind of that opposite. And then it's, okay, well, we'll get you there. And what's the barrier for that? So there is so many really good things about telehealth and the safety of it from my own, that's my own experience of it. So others can do it. Yeah, go ahead.
Sorry, Mariah. No, there was a question that came in while you were speaking that kind of builds, it kind of just builds on what you said, is like, what boundaries have you had to set with doing telehealth that you maybe didn't have to have in an office setting, and how do you navigate those in this environment? First, what are they? How are they different, and then what do you do to make them work, I guess?
The boundaries really for me haven't changed that much, because you come to my session and then you leave the session and then you make another appointment and then you come. So for me, I haven't personally had any issues with it. We do, we have private numbers, we do Google numbers. And so if I have to reach out to a client, I call, I never text anyone. That's confidential, but I'll tell them what the barrier is. This is when you can get a hold of me. Basically, let's act like it's the clinic, right? So for me, I haven't had too much of an issue with it at all. I've been really lucky in that area, but I've been doing telehealth for a while. So navigating the conversation of setting, I think, Brian, you touched on this, and Janelle, setting expectations of the session, what this means. So it's setting up those new boundaries, which folks need. They need to know what's okay and what's not okay. So for me, it's the same rules basically, except now I have a little bit more freedom to set my own while I have them in session instead of them going to the physical front desk staff. So for me, I've been really fortunate, but Janelle and Brian, you can speak to your experiences.
When I would ask Janelle or Brian, like in working with children, is there any difference there in terms of in-office boundaries versus telehealth boundaries? Have you noticed anything or had to do anything differently in that regard? I'll lean on
Go ahead,
Janelle
Janelle.
first. I'm going to lean on Janelle
Yeah.
first.
Well,
Yeah.
before I want to talk about I want to play off of Mariah in that as our office as a whole, we have had some boundary pushing and some boundary setting that we've had to do and kind of some new policies and education with our therapists. We've had crisis calls that have come in at 10 o'clock at night to their Google numbers and therapists who have called and been like, do I need to do a midnight crisis session? It's like, no, don't do that. Set that boundary and call mobile crisis or call the police or call the appropriate number to do that session for you. So being able to educate our therapists and educate our staff on, you treat this like your regular clinic, you treat this like your regular therapy session, even though they know how to get a hold of you at home, you don't have to follow through with that. So that's kind of playing off of that, where we've continued that training for our entire staff, because they are kind of feeling that pressure where it's a weekend or it's in late at night and they don't know how to balance that. And so being able to help that training and being able to help that, like, hey, you guys get self-care too. And you got to take care of yourself too. You don't have to be on call 24 hours a day, 7 days a week. There are other people who do that. And it's okay to call Intermountain Healthcare. It's okay to call University of Utah. It's okay to call those crisis numbers. And so that's really important to not only let our staff know, but for them to educate their clients on that as well. And then speaking to our kiddos and setting up those boundaries. One thing that's been really interesting is talking to them about going to the bathroom. That's been one thing where I've been like, yeah, leave me here if you need to go. I don't need to go with you.
Right? Thank you. Thank you.
So, yeah, physical boundaries like that have been really interesting. Where I've also called parents ahead of time and been like, hey, can you make sure they go before the session? That would be really cool. So things like that have come up where it's been a lot of fun, and we've turned it into this game or things we play with, or show me your room, show me what your life is like, or let me meet all of your pets that I would have never met before. And it's finding those boundaries, but then also discussing what are they telling me in session versus what's really happening at home. And it's nice to see that difference, where they'll be in session and there is that mask when we were face to face, where it was everything's fine, everything's perfect. But then all of a sudden, when I see them doing therapy at home, I see their parents coming in and emotionally assaulting them in the middle of session or pushing their boundaries. And it's like, no, wait, let's stop for a second. Let's talk about that. Or why don't we go outside? Take me outside and let's talk about what just happened, because that's not fine. That's not okay. And that's not your confidentiality. Like that, let's set up that boundary. Let's work on that, and then let's bring in the whole family or bring in that parent.
Yeah.
Well, and talking about who's in the room, and do you have a private space? I mean, those are certainly setting boundary issues. And one thing we've laughed about around safe and healthy families too is that we never thought we'd need to set a rule that no lying on your bed or being in your bed during a therapy session. We found that doesn't work very well. We want them to be more up and engaged, in the process. But I would echo that I have also found it to be in many ways more helpful than being in my office to see kids' behavior as it would be at home. And they're more likely to just be themselves. If I'm working with parents on trying to manage difficult trauma-related behaviors, and it's so much different to be able to see it happening in the moment than to hear about it later when they come into my office. So that has been a positive thing for sure. And I wanted to jump in on the question from a little bit ago about who has really benefited from this experience. And I want to say the parents who have multiple kids and who are coming from far away. When I have a mom I was doing some testing with who are coming in to become new clients at Safe and Healthy Families. I'm not necessarily going to be the therapist, but I was doing we always do some initial brief psychological testing. And this mother has many challenges and a number of kids, all of whom are potentially really in need of therapy right now. And the daunting task that we face at Safe and Healthy Families pretty regularly, or the families we work with face, is how do you go to work, cook dinner, cook meals, and take 4 or 5 different kids to therapy appointments during the week. You can't take them all at once and have them all bunched up and be in the offices for 4 or 5 hours at a time. You can't see them all at the same time with different therapists, because then the parent is never available to participate in some of the other sessions. But it ends up being doable when we can do it this way. It was mentioned, I think, by Janelle earlier, or Mariah, about doing therapy during a lunch break. There is convenience that is really worthwhile and meaningful for folks who are trying to do 2 jobs and, raise kids and have seriously challenged lifestyles in terms of time available to do self-care and or to really actively try to support the therapy that their kids are needing. And so with this parent that I did the testing with this week, would have had to cancel that session, but we ended up doing it from another state. They were still able to go to a place. They were not able to get back to Salt Lake in time to their own house, but it didn't actually end up being a barrier to us proceeding, because she was able to get them to a place with another family member where they had the internet connection that they needed. And so it allows the therapy to move along in a way that we wouldn't have been able to do. So I'm really pleased that there are parents who are better able to, take care of their own stress and help a number of kids get into therapy without completely, throwing off the rest of their routines and their schedules, or to make compromises.
Yeah, and I would say I've had that same experience across the agency I work at. I've actually had clients that say, do we have to go back to coming into our appointment, because I like not having to drive an hour each way, or I like not having to go out. I'm liking the idea of not having to travel in winter. And so it's actually, there's a lot of things to think about moving forward, how this does benefit people, even when we're not in a crisis. So I want to say this, I'm aware of time. We are scheduled 12 to 1, and I'm sure all 3 of you have, like everybody watching, right? People are probably eating their lunch while they're watching this. That we want to make sure that we get people out on time and get you back to your lives, because you've very graciously given your time for this today. So I want to we do have a couple more questions coming in. What I want to say is this, that the College of Social Work that has organized this is absolutely going to be addressing any questions that came through that we couldn't get to. So you'll get some email responses from them. But I want to give a special thanks to Brian and Janelle and Mariah for showing up and donating some time and really sharing your wisdom with everyone that showed up today. It's so very much appreciated. So thank you. I'm applauding, and maybe other people are in their offices and too as they're watching.
Well, glad to do it. Thanks for the invitation.
So I wanted to say one more thing too, is that if you are interested in CEUs, some required questions will be sent out to you through a link, and the recording of this will also be available so that you can do that and get some CEUs through the college. And we do have another event the June 4th, which I believe is next Thursday, if my math is correct. Yes, at the same time, that's going to be talking about it's going to, let me look at the topic and I will tell you, telehealth tomorrow. So kind of what to expect as it ends. And I think we're also going to try and circle back to some of the technology questions that came up that maybe we didn't get back to. So thank you everybody for your time and your expertise. And if you're any questions, I'm sure that the College of Social Work will be happy to answer them, and you can answer those. And otherwise, have a beautiful, amazing remainder of your week and enjoy your weekend.
Thank you.
Thank you,
Bye,
everybody. Bye-bye.